Homelessness is a public health crisis that strickens communities every day. Individuals who experience homelessness face gaps in their lives, whether that be financial or family or faith or just life in general. We are here to help bridge these gaps because we know that nothing can be done alone and we are stronger together. We have been charged with the task of reducing the amount of hospital readmissions and deaths by 35% after discharge at Union Gospel Mission Calvert Place. We are the Red Medical Team and we present to you Bridging the Gaps, a holistic program for reducing hospital readmission and deaths at UGM's Calvert Place. By interviewing staff and guests at UGM, consulting with outside organizations, and researching the literature, we came up with a plan that is feasible, cost-effective, and ready to start working soon. We call it the GAPS program. Besides being an acronym for our recommendation, GAPS references the health and social disparities faced by many people experiencing homelessness, as mentioned earlier. We call it a holistic program because we split our focus between the solutions that are both preventative and targeted. And the program is sustainable as it incorporates opportunities for peer-to-peer education, task shifting, and vocational training that can be leveraged towards future employment. Ultimately, GAPS attacks the problem from multiple angles. The first component of the GAPS program is the Green Initiative. This measure involves building on UGM's own property to create a community garden and outdoor lounge space for access to rest, relaxation, and nutritious foods. The A is the Active Initiative, which is another preventative measure involved strengthening UGM's existing health and wellness programs through partnerships with local organizations. And the P is the Partners Initiative, which is a targeted intervention that pairs recently discharged guests with health partners, UGM disciples who will be trained to provide accountability, monitoring, and support for their peers. And finally, the S for spirituality, which is not so much a recommendation as just a recognition that spirituality is the foundation of UGM and shapes all that they do, just as it anchors and shapes the GAPS program. UGM is the oldest homeless shelter in Dallas, which aims to tackle the issues of both homelessness and health. It holds the most people of any given night and provides a clinic. The organization began when two Christian men in 1949 went to the streets to share the gospel and the love God has for His children. Our health initiatives align with UGM's mission to heal the root of the problem, all in the power of Jesus Christ. The first part of the GAPS program is the Green Initiative. This will be used as a green space that would include an outdoor lounge as well as community garden, as expressed interest from UGM staff and personnel. Benefits of the outdoor lounge would include lower cortisol levels, which would then lower stress, lower blood pressure levels, and lower heart rate levels as a result of the relaxation qualities found at the lounge. We recommend the community garden as a part of our Green Initiative because it would increase overall resident access to fresh produce of fruits and vegetables. This type of diet provides a protective factor for the body against conditions like heart disease, hypertension, and diabetes. Benefits of the garden include an estimated decrease in hospital readmissions of 8% and also an improvement of physical, social, and the psychological well-being of the UGM residents. Active initiative of the GAPS program is a recommendation that will not only act as a preventative measure, but as well as health maintenance for the residents of UGM. The goal of Active is to encourage residents to build a connection to their bodies through wellness activities. This will be done by building off of the pre-existing health programs at UGM and incorporating new weekly exercise classes that will put into practice the idea of being a good steward to your body. The 3 new partnerships that will be with the Active program will be Shazzy Fitness, the #1 Christian-based Zumba in the country, Bike Friendly South Dallas, a partnership for community bike rides, and the Well Ministry, a partnership with Watermark Church. Our final recommendation is Partners, or the Health Partners Program. which would employ disciples to offer care and a peer support network to the UGM residents who are ill. The Health Partner Health Checks would act directly as an intervention tool for individuals who have just been released from the hospital. Trained disciples will conduct mental health surveys, physical assessments, patient navigation, and social support. The impact of this program would improve chronic disease management, decrease mortality, decrease ER visits by 40%, and readmissions by 33%. This could act as vocational learning skills for the disciples without a huge cost to UGM. A great thing about the GAPS program is that it is completely cost efficient and works under the budget UGM has provided us for this project. Now that we've gained the bigger picture of the GAPS program, we can truly understand the preventative measures and the targeted interventions that it can provide the UGM residents that need it. And this is how we are going to bridge those gaps. Thank you.